if a child has been diagnosed with asthma and a parent is still trying to figure out what to do, maybe they have been a smoker or something like that, what are the everyday things that they can do to help their child out?
Well, there are a number of triggers that are there for kids, and so trying to limit those triggers as much as possible really becomes important. And triggers are all over, and so sometimes you can prevent them, and sometimes you just can't. So for things like tobacco smoke, or wood stoves, or just burning wood in general, or burning the grass outside, those can be significant triggers, and trying to keep the child away from there. Dust mites, common allergen among both adults and children, can be found everywhere in every household. And so using dust mite protection, both on the mattresses and the pillows, will help eliminate that concentration of dust mites there, and just with careful cleaning. I'd love to be able to say we can control air pollution, but we can't do that. But being sure that if it's a really a humid day and they talk to you about bad air quality, try to keep the kids inside. Use a lot of air conditioning as a way of trying to clean that. Cockroaches, just like dust mites, are another allergen, very difficult to control, found frequently in a lot of other places. And then, unfortunately, sometimes rover or kitty can sometimes be the major cause of it. Furry animals are the #1 triggers in kids as well, so being careful about that. Keeping your household clean is real important. Molds, especially around the bathtub, so that when you get in that tub and you get the warm air, it kind of brings those molds out. Those can be really, really big problems as well. And then also it's hard to take care of things like colds and flus, but being careful. Taking the flu shot is very important for a child who has asthma to help prevent that from happening. Understanding that both cold air, that's really dry, and crisp and cold, as well as the really humid hot air, can both be irritants to the child as well. And then just being careful. Sinus infections or just sinus congestion, allergies, being careful, make sure any food allergies are taken care of. And you often hear about kids who, when they get stressed, they get anxious, they start going into a panic attack. You see that frequently on television. The panic, the anxiety itself doesn't bring it on directly, but usually when you become emotional, you start hyperventilating. And now you're drying out the air and you're irritating the airway. And that causes the lungs to then overreact, and then you start getting tight, start getting the asthma.